Hello, everyone. I'm Jessica, and I am here today with the next installment of our monthly videos for the Awesome Love Well Foundation. So, for February, I decided to talk a little bit about anxiety and depression. I'm not going to go into a lot of super specific details, but there are a couple things that I think are really important. And let's face it, with everything going on in the world right now, with the pandemic and just everything, isolation, quarantine, everything has increased. A lot of mental health issues have gotten worse, and depression, anxiety, suicide, substance abuse, overdose. It's all increased over the last 12 months just because people are scared. People are scared of getting sick, scared of going places. Fewer people are reaching out for help because a lot of resources are limited because of the pandemic, but also, some people, they're just afraid. They're scared to go into a treatment facility because they are afraid that they'll get sick. And these are all valid concerns. So, because we are seeing such an increase in depression and anxiety, I thought that I would just talk about it a little bit, and not just about the actual disorder and symptoms of it, but also maybe what you can do as the partner or family member, friend of someone who is maybe having a lot of problems with depression or anxiety, and kind of what you can do just to try and be helpful. So, depression, a lot of people think of this as just being sad all the time. But, it's not just about sadness. Depression, it is kind of an all-encompassing problem. So the difference between normal human emotion of your kind of up and down moods that we all can have, we have good days and bad days. The difference between that and a depressive disorder is when the symptoms are happening in the absence of any precipitating event. So, it's normal to get upset or feel sad if something happens. You lose your job, you break up with your partner, or you have a fight with your partner, something happens in your family, you're struggling with finances, things like that are events that are going to kind of trigger probably some symptoms, like you might be sad, you might not want to get out of bed, you might not feel like going anywhere, not being social. That's normal. But with depression and a depressive disorder, there may be no event, and also the symptoms don't resolve. So when you're having a normal response to an event, after a few days, maybe a week, you start to feel a little better, things start to pick up, you start going out again, you start functioning kind of back to whatever your normal was. And with depression, when it's a true depressive disorder, that doesn't happen. So no matter what you do, you kind of can't get out of this funk. So usually we ask people if you have feelings of hopelessness, worthlessness, do you have feelings of sadness, crying spells, trouble sleeping, changes in appetite. Some people eat more, some people lose their appetite, some people sleep more, some people can't fall asleep. So just changes in what would be your kind of baseline. And we ask if you've been having those symptoms for most of the day or most days for at least the last 2 weeks. Most people, I will tell you, do not have depressive symptoms for 2 weeks and then look for help. Usually they are experiencing depression for a much longer amount of time before they actually come in to get help. But, so those are some of the things that we look for, some of the symptoms. As a friend or a partner, a spouse, a family member of someone who is exhibiting some of these symptoms, what can you do to help? So here's what I can tell you. There are a few things that are key that I think it's important to know that are very much not helpful. So, for instance, telling someone just to snap out of it, or saying something like, "Oh, but you have so many things to be happy about. Why are you sad all the time?" Or saying to them, "You think you have it bad. It could always be worse." Or maybe comparing what they're going through with something you've been through. These are all things that are not helpful. The person is not choosing to be depressed. The person is not choosing to feel sad. Most of the time, they want to go back to their normal life, right? They want to go out with friends. They want to enjoy things they used to enjoy, but for whatever reason, they're not able to. What you can do is, validate their feelings. I understand that, you're going through a tough time. What can I do to help you? Ask them how you can help. Offer to do things, go to the store for them. Maybe run some errands for them. Take some of their responsibilities that at that time seems really difficult for them and offer to help. You can always offer to help them find help. My doctor has told me before that this clinic down the street is great with behavioral health. Maybe we could call and see if they can get you an appointment. Offer to help in those ways as opposed to trying to, talk them out of it. It's really, in the long run, those kinds of things, those comments are going to make them feel worse because now they're not only feeling sad and, upset about being depressed, but now they feel like they're a burden to you, or maybe they're not able to snap out of it, and they should be. So it kind of has an opposite effect, even though people really want to say, well, just get better. But unfortunately, it doesn't work that way. So, if you were talking to somebody and they said, "Oh, well, I'm a diabetic," you wouldn't just say to them, "Well, just stop, like, just snap out of it." And mental illness is a disease just like a lot of other things, so you can't just turn it on and off. So that would be some of the things I would suggest if you know someone who's experiencing those symptoms of depression. Anxiety is also on the increase. A lot of people are very anxious these days because of the pandemic. They are anxious about going places, anxious about getting sick, anxious about their family members getting sick, anxious about the vaccine, just anxious in general. I think that I probably have no less than 5 patients a day tell me, "Oh, everything's been much worse this last year." So it really has had an effect on everyone. Anxiety can be normal, and again, a lot like depression, it is normal to respond to certain events with anxiety. But if the feeling of fear, worry, feeling like something bad might happen, just constant worry about things that are way beyond your control, things that are interrupting your sleep. You can't fall asleep because the thoughts are just racing through your head all the time. Those are signs that the anxiety is more than just a normal reaction to an event. So, some people have phobias where they're afraid of something, one particular thing. Some people are afraid of flying. Some people are afraid of spiders. Some people are afraid of heights. Those are all different kinds of anxieties. And then there is generalized anxiety disorder, which is just anxiety all the time over things that you can't control, things that you just can't stop. You cannot stop the worry. So people who have a general anxiety disorder, or really any kind of disorder, tend to show fear, Sometimes they're afraid of going certain places where they've had, a lot of anxiety or even a panic attack before. They have trouble concentrating. They may, again, have trouble sleeping, or with their appetite might change. They might feel tired. They might feel restless all the time. They're not able to sit still when they need to, because again, it's just a constant worry. So when that starts to affect your daily life, that would be when we would start to consider this more of an anxiety disorder, rather than just a normal response. Things that will not be helpful if you have a friend, a family member, whoever, that is experiencing some pretty bad anxiety. Again, telling them to calm down, or to just get over it, is not helpful. They can't. They want to. They People will say, I don't understand what you're afraid of. It's just not a big deal. Like, it's just an elevator. What are you so afraid of? Those things are not super helpful. Don't, again, try and compare your feelings. Well, if you think you have anxiety, you should have seen what I had to do. Or tell people, and this is one of my biggest pet peeves, that it's all in their head. You're in your head. You're too in your head. Just get out of your head. Forget about it. That to me is one of my biggest pet peeves, because if these people could just turn it off, I'm sure they would. Anxiety is a miserable feeling. Nobody wants to have it. So those things are not helpful. Things you can say that will be helpful. Honestly, just letting them know, like, hey, I'm here. Is there anything I can do for you? I can tell that you're worried. Why don't you talk to me? Tell me what's going on. What are you thinking about? Let them kind of talk through it. Sometimes that's what they need, is somebody to just go, okay, so what are you nervous about? Tell me what it is and let's talk through it. We teach people a lot of times, when you're anxious or having a panic attack, to think about all of your senses. So, some of it is a little bit of maybe the art of distraction, but it does work to calm you down. So if you're feeling super anxious, or you're with someone who's feeling super anxious, try and help them. Okay, so tell me, what do you see? All right, what do you hear right now? And just being able to kind of ground themselves, stop and think, okay, well, let's see, I hear, birds chirping. I can hear the leaves in the wind. I can, smell that someone's barbecuing, just anything that they can kind of take their mind off of the actual anxiety and panic can be really helpful. So we do teach people that technique as well, and it's something that you can do if you're with someone who starts to experience a lot of anxiety. So those are a few things. Depression and anxiety are so common, and there actually are a lot of really, really good treatment options. Again, I'm not going to go into a lot of specifics. If you have questions, you can always feel free to email me your specific questions, or, ask me anything. But, luckily there are so many options of, therapy, and then many, many different medications that can be helpful with both anxiety and depression. Medications that you take daily, medications that you can take just when you need them. And, it's a very, very treatable disorder. Both anxiety and depression are both very treatable, very common. And people, unfortunately sometimes are, I think, ashamed to reach out, because they feel like, they should be able to handle this, or they should be able to snap out of it. But the truth is, again, it's an illness just like a lot of other things. If you have high blood pressure, we don't tell you, just calm down, bring your blood pressure down. It doesn't work that way. And the same is for mental illness. It's, chemistry in your brain, and sometimes it just doesn't work like everyone else's. Everyone is an individual. So, it's an easy thing to talk about when you're not the one experiencing it. But, the best thing you can do if you know someone or you're with someone who's having these problems is to just be supportive, help them find help. And, I think that is one of the best things that you can do for them. So, anyway, that's this month's little talk. If you have any questions or want to discuss anything in more detail, please don't hesitate to email me and reach out, and I will be happy to get back to you.